इंदौर से हैं। ये मेरी बेटी प्रिंसी जैन है। ये 2 साल 11 महीने की है। इसे किडनी की बीमारी से ग्रसित थी। यहाँ MGM में इसका सफलपूर्वक किडनी ट्रांसप्लांट हुआ है। किडनी ट्रांसप्लांट के समय इसका वजन 7 किलो था। किडनी ट्रांसप्लांट के पहले हमें बहुत समस्याओं का सामना करना पड़ा। जब ये 6 महीने की थी तब हमें मालूम पड़ा कि यह किडनी की बीमारी से ग्रसित है। उसके बाद इसका निरंतर इलाज चल रहा था, पर इसके डेवलपमेंट में धीरे धीरे ही वीक होती जा रही थी। इसका पोटेशियम, इसका BP, हर चीज़ इसकी बढ़ी हुई थी, पर यह सिर्फ कुछ दवाइयों पर ही निर्भर थी। उसके बाद लास्ट मार्च में इसका यूरिया और पोटेशियम अनकंट्रोल हो गया। तो वहाँ पर इंदौर में हमने जब इसको दिखाया तो वहाँ पे इसे डायलिसिस पर लिया, पर डायलिसिस होने के बाद इसकी कंडीशन और भी ख़राब होती गई। धीरे धीरे ये और वीक होती गई। इसने चलना फिरना, इसके मूवमेंट सब पूरी तरह से बंद हो गए थे। इसकी भूख में कमी, वजन में निरंतर कमी और बहुत सारी कॉम्प्लिकेशंस इसके साथ होने लगी थी। ये बहुत इरिटेट हो गई थी और बहुत ही ज़्यादा वीक हो गई थी। फिर हम लोगों ने डिसाइड किया कि हम एक सेकंड ओपिनियन लें। इस सेकंड ओपिनियन के लिए हम लोग चेन्नई आए। यहाँ हमने डॉक्टर सुकन्या गोविंदम मैम को दिखाया। जब हमने इसको दिखाया, हम लास्ट जुलाई में आए थे, तब मैम ने हमें इसे एडमिट करने का एडवाइस दिया। इसको हमने यहाँ 6 दिन एडमिट रखा। उसके बाद हम लोग इंदौर गए। मैम ने हमें ट्रांसप्लांट करने का सुझाव दिया।
So this patient came to us in July of this year with many medical complications like high potassium levels, frequent infections, and very poor growth. So after the initial management of this child for managing her complications, we offered her the option of undergoing a kidney transplant with her mother as donor. And when the standard of care for children for kidney transplant is offered to them only after they reach a weight of say 15 kilos because of the inherent surgical challenges that they pose because of their small size. But for this child, we felt that going ahead with a kidney transplant despite the high risk is necessary to avoid further complications and give her the best quality of life. So she recently underwent a kidney transplant with her mother as donor. She was only 7.5 kilos at the time of transplant. The team has Dr. Anil Vaidya, who's a renowned multi-visceral transplant surgeon, and we have an excellent ICU care and a team of anaesthetists and paediatric intensivists to take care of this complex child. So we're able to do the surgery, and right now the child is doing very well. She's accepted the kidney very well from her mother, and there were no major complications in her care. And we hope she's going to grow well and sustain her healthy kidneys well.
What you just said reflects what must be happening to so many children around India who have no access to a transplant center that can do really very, very small kids. As you rightfully said, people will wait till kids are 15 kilos and more, and to make it technically less challenging. But there are programs like our program here that we are happy to indulge and take on these very small kids. And very small kids is anything below 10 kilos. And this child was 7.5 kilos. The challenge really is where you're going to place the kidney. The size of the kidney is as big as a child's abdomen. And sometimes that fit could be challenging. So with our experience and with the backup of our intensivists and anaesthetists, and with Sukanya looking after the child in the post-op care, we successfully transplanted this child. The message out there is it's better to transplant them earlier and let them go through a growth phase, and not only physically but mentally, cognitively, through their early years, without having the reliance on dialysis. And essentially for these children, the only dialysis you can actually give them is peritoneal dialysis. And we all know that after some time, peritoneal dialysis starts failing because the abdominal cavity cocoons itself, and there's not any fair dialysis that can happen after some time. There's also infections from peritoneal dialysis catheters, that could cause catastrophic problems in the abdomen for the child. So message is earlier transplantation is the way forward. Specialist teams should be doing this. Not everyone should be doing this. We at MGM Healthcare have a specialist team to deal with these ultra small or rather sub 10 kilo babies, and we can successfully do their transplant and follow them up long term. The other thing that I'd like to bring to the forefront is the avoidance of steroids. We tried to use immunosuppression up front, and the drug we're using is alemtuzumab, which is free for the patient. And there are massive benefits for the children to not be on steroids, because they're in their growth phase. You don't want to hamper the bone density with steroids in these patients. And that's another plus point, to have a transplant in a center that actually knows what immunosuppression to be giving patients and how to keep them steroid free.
मैं काफ़ी खुश हूँ। मेरी बेटी का जो ट्रांसप्लांट हुआ उससे मैं काफ़ी खुश हूँ। पूरी टीम ने बहुत मेहनत की है, स्पेशली थैंक्स टू डॉक्टर वैद्या, जिन्होंने इसके लिए इतनी दूर से आए और इसका ऑपरेशन किया। और मैं अपनी वाइफ के लिए भी बहुत थैंक्सफुल हूँ, जिन्होंने अपनी किडनी डोनेट करी है अपनी बच्ची के लिए। और आज हम बहुत खुश हैं, पूरा परिवार हमारा बहुत खुश है। सबकी दुआएं हमारे लिए काम आई है, और मैं कुछ बोल नहीं सकता, मेरे पास इतने वर्ड नहीं है जो मैं परिवार के लिए और बाकी डॉक्टर्स टीम के लिए क्या बोलूँ। तो बच्ची अभी सिर्फ 7 किलो की है, डॉक्टर ने इतनी बड़ी रिस्क लेकर और इतना काम किया, उसके लिए थैंक यू सो मच। आई एम वेरी थैंकफुल फॉर हिम।
And I hope that this message does get out to many parents out there who unfortunately had kids on dialysis and haven't been given the chance for a transplant. Here at MGM Healthcare, we believe that there has to be equity in access. Everyone out there needs to be able to reach out to us and see. Not everyone may qualify, and Dr. Govindan may go through a algorithm to see whether the child qualifies for a transplant or not, but we're here to help. So equity of access is really important for us, that we spread this message and get many more parents aware that actually they don't have to wait on dialysis and they can get transplanted. Thank you.